Assalamualaikum warahmatullahi wabarakatuh. I would like to say thanks for coming to my presentation. It's great to see you all. Let me introduce myself. My name is Julius and I'm from Institut Kesehatan Prima Nusantara Bukit Tinggi. The purpose of the presentation is to explain our project on the title, the correlation health education and level student knowledge of drug at the SMK Pembangunan Bukit Tinggi. The first until the third author come from Institut Kesehatan Prima Nusantara Bukit Tinggi. This research began with preliminary observation of the SMK Pembangunan Bukit Tinggi. On observation from 10 students, 9 students who did not know about drug and the time of drug, and only 1 student who knew about that. Information obtained from Wakil Kepala Sekolah and Counseling Guidance or BK, the total number of students is 273 people. The people has never conducted a urine test on its student, so the school cannot confirm whether the student is involved in drug use. Drug use in West Sumatra in 2020 is ranked 10 of 33 provinces. Data obtained from Bukit Tinggi Narcotic Resort in 2019, 17 people use sabu, marijuana, and ecstasy. And in 2020, 40 people use sabu, marijuana, and ecstasy, all of whom were adult and not one consumed drug at the student level in Bukit Tinggi. Purpose. This project aims to investigate the correlation between health education and the level of knowledge of students about drug in the SMK Pembangunan Bukit Tinggi. Method. Type of research is a quantitative study with a cross-sectional design. Sample and population. The population is all students in class 10 and 11 at SMK Pembangunan Bukit Tinggi in 2021. A total of 277 people. The sample for this study was taken using statistical rules at significant level of 1.10, so the number of sample was 70 respondents. Research tool and instrument. The tool used in this research is questionnaire. The research questionnaire contains questions on health education and student knowledge of drug. Data collection and processing. Data collection begins with carrying out a preliminary survey on the correlation between health education and the level of knowledge of students at the SMK Pembangunan Bukit Tinggi. Once the initial survey was found that comply with research rule, the researcher continue to collect the research data. Once the data collection is complete, the data processing is carried out. The steps in data processing are editing, encoding, data entry, and cleaning and tabulation. Data analysis. The data were analyzed using 2 methods, univariate analysis and bivariate analysis. Result and discussion. Respondent characteristic by age average on 16 years old, by sex are male and dominant respondent in class 10. On univariate analysis, based on table 4 from 17 respondents, on univariate analysis, based on table 4 from 70 respondents, more than half of respondents had health education. On table 5 from 70 respondents, more than half respondents had low knowledge. On bivariate analysis, based on table 6 from 70 respondents, 38 respondents are exposed to health education. Of this number, 20.1% have a high level of knowledge. The result of statistical tests between health education and the level of drug knowledge p-value is 0.028, lower than 0.05. It means there is a significant correlation between health education and the level of knowledge of drug in the SMK Pembangunan of Bukit Tinggi in 2021. Statistical calculation obtained the value of OR or odds ratio is 3.37. It means that students have 3.37 times the possibility of having low knowledge of drugs. Conclusion. The study have the following conclusion. 1. More than half respondents receive health education. 2, more than half respondents have high knowledge. And 3, there is a significant correlation between health education and drug literacy level of the SMK Pembangunan of Bukit Tinggi in 2021, where p-value are 0.028. Acknowledgement. Reference. And thank you for your attention.